My name is Rosemary, and this is my story to share. Let's see, in 10 years I'll be 31, which I totally can't picture right now because that's so far, but let's see, if I had it my way, I would definitely be involved with the public health field. I could definitely see myself working for the county hospitals, either doing administration or some type of health education program. I could also see myself possibly working for the Santa Clara County Health Department because it always seems interesting to work for the county and be involved with what, is going on with the whole community. As far as education goes, I'd probably maybe be finishing my MPH, maybe starting it depending on where I am in my life. I just definitely want to be set in as far as advancing my career. Let's see, I would also probably want to get all that done before I have kids so that I can provide the best for them. I might be married, I don't know, because you never know when you're going to meet that right person, and depending on where I am in my career, that comes first. And overall, I just see myself reaching my goals and trying to be the best that I am while having fun and maintaining my own health as well. Health science is such a broad term, So many aspects create health science that's very hard to pinpoint just one definition, and I'm sure we all have definitions of our own. But for me, it's about public health, but more of the research behind the scenes aspect of it. It's about researching different populations and communities and knowing those health issues that affect all of us, or maybe just certain groups. It could be used as just purely research and studies, or it can be in order for us to find solutions and create interventions that are tailored to specific groups in order to eliminate these health risks or diseases. For me, it's just more than medical care alone, because we have to understand these different groups and populations and to know what they need, what their risk factors are, and what their different illnesses and diseases are, because we're all different. We all don't necessarily have the same values, background, religion. We all have different beliefs, and our health is affected by that and what we choose to do or how to seek care. And health science is basically about investigating all of that and coming up with a solution to eliminate disparities so that we can all be equal and have equal access to care. So yeah, that's pretty much what health science is, and it's the glue that holds this healthcare system together. For me, I don't necessarily identify with a particular culture, but because I was raised in the Bay Area, I've been exposed to so many different other cultures. By going to school, I've been exposed to what health means, and basically by what the media and advertisements portray what health is. It's basically how you feel or how you live your life, your particular lifestyle. Being healthy is being free from disease and illness, or if you do particularly have a disease or illness, you're maintaining it, you're taking care of yourself. Health is basically seeking care when you need to, or if you can, or preventing illness or disease however you can possible. This is by living a healthy lifestyle, which means eating healthy, being active, getting enough sleep, and avoiding risk factors such as drinking, smoking, doing drugs, which we all don't really sometimes follow that, but that's what you need to do in order to keep up with being healthy. It's just a matter of, how you want to live your life, and that's pretty much what health is. In order to have a healthy community, Not only do they have to live a healthy lifestyle, which I mentioned before, being active, eating healthy, avoiding certain risks, but also you kind of need to study the community and know what their needs are, what their risk factors are, what illnesses or diseases they're prone to, and you basically need to put it all together and come up with an intervention that is tailored only for them, because that community is going to be a lot different than another. And basically a big part of being healthy is seeking preventative care, which I know we don't necessarily have an emphasis right now in our nation, but that's basically a very big part of whether or not you're gonna get a disease or illness. If you're taking care of yourself, going to your primary care physician and taking the correct steps in order to know how to maintain your lifestyle. But right now, because there's so many health disparities and financial aspects of seeking care, it's very hard for everyone to do so. And that's basically what health science is about, and researching in order to make that all happen.